أهلا بحضراتكم. احنا النهارده متواجدين داخل مستشفى أهل مصر للحروق، وهي أول مستشفى متخصصة لعلاج الحروق بالمجان في مصر وأيضا في الشرق الأوسط. بدأت أعمال الحفر في المستشفى في سبتمبر 2018، ومن المقرر افتتاح المستشفى في الربع الأخير من 2022. زي ما حضراتكم شايفين حواليا، احنا النهارده داخل المستشفى بالفعل. هذا الصرح الكبير اللي يعني بيتم بناؤه من 2018 ولحد النهارده، وهي مستشفى أهل مصر لعلاج الحروق بالمجان. احنا موجودين النهارده عشان تتعرفوا معانا على البروفيسور نعيم مؤمن، رئيس الرابطة الدولية للحروق، وأيضا رئيس المجلس الطبي والبحث العلمي بمستشفى أهل مصر. وقد إيه الحقيقة احنا فخورين بزيارته لمصر وإضافة خبراته العالمية لمستشفى أهل مصر لعلاج الحروق بالمجان. قبل ما نبتدي لقائنا هنوه على حضراتكم ان الانترفيو هيكون باللغه الانجليزيه، ولكن هيكون ايضا مترجم. يعني الحقيقه خليني في البدايه اقول لحضرتك اهلا بيك، نورتني وسعيده جدا بهذا اللقاء.
أهلا بك، أهلا بحضرتك. Thank you very much.
First of all, Professor, I would like to ask you, how would you describe your visit to Al Masr Brain Hospital?
I have been with Al Masr and aware of the huge program and the project that they are doing, not just Al Masr here, but also the Al Masr Foundation since 2016, with my first contact with the team and Dr. Heba and Dr. Adel of Al Masr, and I've been following this through all the time. And I must admit at the beginning, I wasn't that convinced that this can happen in Egypt, but as the time went on, I was very impressed that a building like this can exist here in Cairo, and this matches the best in the world, and obviously the Middle East and Africa as well. It could be one of the foundations of burn care here in this country, and we should all be proud of what has been achieved in a very short time period. The building, as you mentioned, started 2018, and now is very small period down the line with the COVID, with the problems, with the supply chains, with everything that can really hinder construction of a major work like that. It's very impressive, very, very impressive. And I'm looking forward to consolidate this and provide the best care for the patients here in Egypt and in the whole of the Middle East.
I would like to ask you about your role and the service you provide to the hospital, especially since you took the initiative due to a personal experience from the beginning.
When I start looking after patients in burn care here in Egypt, before I went to United Kingdom in the early 80s, you can see young kids with very small burns, maybe a fifth of their total body surface area, which should really survive smoothly without any complications. They die, and not only in Egypt, it's everywhere, even in United Kingdom, even in the United States. That was the early 80s. And this really, you make feel inside that it should really happen. And through all over my career, it's really seeing kids recover from burns and survive it, and also go through rehabilitation and move on in their lives, and see them through the journey. Since 6 months, I have a patient 6 months now, is married and children. It's great to see that. So to see a patient with major burn, like 95% of total body surface area, that's only minute part of their body hasn't really burned, survive and move on, and then you follow them up over the years. I think that's the best pleasure you can get from being a burn surgeon or being a burn professional. And that's what really inspired me all the way through to do what I'm doing. And at the end of the day is when you see good outcome, it moves you to try to achieve more, better outcomes. And I think that's fundamental, and that's the commitment for any professional in this very hard work, from very hard subject. Burns is tough specialty because it's very tough. Physically, it's very demanding, and also emotionally, it's very demanding.
How important is it to have a hospital like Ahl Masr hospital for the treatment of burns in Egypt, and also serving the MENA region?
In Egypt, there is huge talents, surgical talents and experience, and what is really missing is the system and the infrastructure, and that's what Ahl Masr has provided. And I think they will be the combination of the Egyptian talents and the high quality care that could be provided here. And I mean, when you go and see what is actually here, I have been here several times. When you go and walk around and see the infrastructure and how perfectly that's really built to provide the best care, it will be very impressive. So what AHLM has created is a system that will bring the talents and just not to provide care for the patient, but also to provide a training for the young generation of burn surgeons to spread the knowledge, not just here in Cairo, but across Egypt and the Middle East.
I would like to know more from you, Professor, about the burn rates globally and locally, and what are the most common causes of burn accidents?
It's a very different story from medium and low-income countries and high-income countries. The number of burns in high-income countries is reducing all the time, which is a great thing, especially in children. Unfortunately, this is not the case. 95% of burns actually happens in low and medium-income countries. That's why not just burn care is important, also prevention program, which AHLM does, is very crucial to the whole program is really very important to cover all aspects of burn care, rehabilitation, psychosocial care, and also acute care and prevention. So the whole things that is the foundation is achieving at the moment is fundamental and will change the lives of people.
Would you list, in your opinion, the leading burn hospitals in the world?
The leading hospital overall, the good leading hospitals are because of the people, their commitment and the what they do for their patients.
You mean the staff working behind the
absolutely,
hospital?
The staff.
Yeah.
And that's very important. And here we will be providing the best care for the patients because there is great nursing staff, there is great surgeons and doctors and intensivists, and the whole multidisciplinary team will come together and work together, and I'm sure we'll provide the best in care.
To what extent do the specifications of AHLM Hospital for Burns match the international standards?
During the journey with AHLM for the last 6 years, I was very impressed that they never compromised in anything. Expenses were not the best in quality and structure that we see here.
Yeah, as you said, also they started from the infrastructure.
Right, absolutely right. I mean, the building infrastructure, the specifications is the highest standard they can ever use. They use the best contractor, the best designers, and they didn't cut corners. Everything was done to the very high specifications. And equipment the same. Equipment, the best equipment in the world from the best companies and the best machines are procured and they will be used here in the hospital. So I think there is no cutting corners, no compromise, everything to the best quality and standard anywhere in the world. This matches the best part of the world.
What are the devices designated for a burn patient?
What is the hospital here provide is the best equipment from the time of entry to the emergency department, to the intensive care, to the wards, and to theaters. All the equipments are the best available and the most reliable that cannot fault at all our care.
How will the hospital help in the treatment journey of the burn survivors?
Our aim is really to improve outcomes. There is very good outcomes in certain places in Egypt or Cairo, but our aim here is to bring these people together and provide, as I said, the best in care and increase, first thing, the survival. We really need to get patients with massive burns, especially children really, to survive and support them and keep them going. And I think we have everything we need here.
Yeah.
I think that will be a wonderful opportunity and make us all compassionate and want just to do and give the best.
How did Professor Naim's scientific and academic journey help transfer his experience to Egypt?
The fundamental thing is really the proper care that we need to provide to our patients. This is the basics really. We need to provide this and make sure everything is done properly to the best of our capability and knowledge.
Yeah.
And after this, the improve and move forward is engagement in research. And we know research improves clinical care. So we need to really bring in a research program that will be internationally accepted, internationally renowned. And this will provide not just care better care for the patient, but also bring this center to the front of the world and will be well known across the world, because we wouldn't just provide good in care, we provide also the best in research that can benefit patients everywhere. And the number of, the best center really should be in medium and low-income countries, because the number of acute burns is huge here.
Yeah.
So actually research here will flourish very quickly, because we can do things that cannot be done in Europe or the United States because the lack of patients. Here we can actually do a great program with research.
So what's the criteria by which the medical staff and the burn nursing team are selected upon?
As we've been discussing during the last few days, we've been having every day very detailed discussion with the whole team here in AHLM. I think the fundamental thing is commitment, and as long as you get committed staff in all levels, from the cleaners really up to the head of the hospital in all grades, if everybody's committed to the cause, I think we will provide the best we can do.
How will the presence of a bank such as the skin transplant and production bank help the patient's treatment journey?
That's a very fundamental question really, because we know if we want to improve and push the boundaries and make survival for burns patients who have a big part of their body burned, we really need to have skin substitute, what we call a skin substitute, or skin banks, which unfortunately is not in Egypt. And to push the boundaries, we have to work with everybody here in the burns community and the government, and to make sure that we have really a skin bank available, because this can actually improve the care at least by 50%.
So Professor Na'im Mؤمن is currently the president of the International Burn Association and the supervisor of the British Burn Treatment Organization. Is that right?
Yeah, I do work in University of Birmingham full-time at the moment. Hopefully will change once we start moving here. And I lead the research program in University of Birmingham for burns for the last 10 years. And I think we have, in a way, this has improved patient care. But as I said, here with the large number of patients in need here, I think the future of research here is really promising. So I hope that what we've done there in Birmingham make us in the forefront of European research. I think we could do it here as well.
So what are your most important achievements in this sector?
I think care of the patients, the improving care of the patients should be the focus of everybody in the team. And I think if we keep this our focus, our strategy, every day how we make things better from the acute phase till years down the line for these kids that we saw today, I think that's the fundamental aim for us all here.
After visiting the hospital and the building as we see for the first time since 2018, I would like to ask you and know your opinion in Al Masr Hospital from the medical side and also from the technical side.
The first time I came here in this site probably was 2019. It was only concrete, and it was exciting because that was it was good to come here and see how things are progressing. And then when I went around yesterday again, it's just amazing to have this hospital in Egypt and in Cairo. It's just amazing achievement. And as I said before, this matches the best in the world. And we should really be trying from that. It is actually the best in the world.
Thank you so much, Dr. Na'im, for this interview. It was my pleasure meeting you and interviewing you, sir.
Thank you.
بكده مشاهدينا ومتابعينا نكون وصلنا لنهاية هذا اللقاء. كنت مع حضراتكم شروق وجدي. شكرا لكم وإلى اللقاء.